And Dr. Alphonsus Aigbiremolen is here with me in the studio. I told you earlier he's a health system strengthening consultant with the World Health Organization. You're welcome, sir.
Thank you.
Okay, now let's start this way. What is this about Edo State entering the maximum stage of infection as regards a spread of COVID-19? We earlier heard from the governor talking about it in his broadcast earlier, that there are possible increase in the number of infections in the coming weeks.
Okay, the nature of the transmission and spread of the coronavirus is such that over here in Nigeria, we had the first set of cases that were imported from countries outside of Nigeria. And we could easily tell from those first few cases that these persons came from country A, B, and C. That was the scenario of imported cases. But then later on, we now had people who had direct contact with those initial imported cases. Those ones fall into the group we may call local transmission.
Okay.
Now, at a certain point, if you do not succeed in breaking the transmission at that stage, you have a situation wherein more persons in the community or in the state or in the nation like Nigeria will begin to get infected, and you cannot exactly trace those infections to particular persons, meaning that they may have been infected by exposure from multiple sources, by exposure by touching surfaces and not necessarily coming in contact with individuals. At that time, you can't link them to index cases. That's the stage where we say we now have community transmission, and that usually happens after a period about 3 to 4 weeks, like we have observed in many of those countries. And at that time, you may have figures jumping. You could move suddenly from 10 to 100 in a day, and then like we have seen in the US and Spain and Italy, jumping into thousands within a few weeks. And that's what I believe His Excellency, the Executive Governor, was referring to. And that's really the concern. The concern at that point is beyond the fact that the disease is deadly. It is that we do not want a situation where the spread overwhelms the health system, the capacity of healthcare workers, the capacity of health facilities to respond. I paint a simple scenario. If you have 100 cases of COVID-19, for example, in the States, and then you have like 200 or 300 bed spaces, and you assume that a large number of those 100 cases were admitted, and then suddenly within 2 weeks you now have 500 cases. The question is, where are the bed spaces? Where are the ventilators? Where are the trained healthcare professionals to attend to these conditions? So that's the concern here, and all measures need to be taken to ensure that we do not get into that stage. And even if we do get there, we would have been ready on all fronts.
Okay, I understand there is call for concern, but is there cause for alarm? What should people be doing differently at this point?
What people should be doing differently includes the fact that people need to adhere now more than ever to all the measures that have been publicized since the beginning of this pandemic, which includes the issue of social distancing, the issue surrounding self-isolation, and the issue surrounding early reporting. For example, the measure that the government is now considering that are taking effect from today, shutting down markets, were because people refuse to comply with the simple directive that we're given. Now we're talking about prosecution, we're talking about seizing people's goods, we're talking about impounding vehicles, because we want a situation where people are able to comply strictly now. Because if we don't do that, we may get to a situation where the problem might spiral out of control, and we'll have to do much more to be able to bring it back to under control.
Okay, now with the start of the fumigation of markets, I'm just wondering, will this add value to the fight against the spread? How will this stop spread of the virus from infected people to others?
It will add value. It will add value. The value is in the fact that the transmission of the virus, apart from occurring through droplets, when people sneeze, they cough, or they talk, these droplets can also attach to surfaces. Benches in the market, door handles, and items around the market. So what the fumigation does is to provide an environmental solution by fumigating wherever the viruses may have be bound to surfaces they kick them off with those chemicals in the fumigation equipment.
Okay, now we are seeing a situation where it seems that people are not really adhering to government's directive or government's advice on social distancing. We could see them in the markets, the women in the traders and buyers in the markets. To a large extent, they don't observe the social distancing measure. Now, can you throw more light, especially on gains when people observe this social distancing, especially as we have seen in developed countries?
Okay. Social distancing, for me, is the single most important non-therapeutic response to this pandemic. By that I mean, okay, there are experimentations here and there on medications that can treat. There are things like using face mask, and then using gloves, and then if you're a healthcare worker, using all of what makes up the personal protective equipment. But social distancing is something that everybody can practice. You do not require any special healthcare training. You don't need to be a doctor or a nurse to practice social distancing. What social distancing does is that it helps to break the chain of transmission. The droplets of the virus are able to move in the air to an extent of about 1 meter from the person who produced the droplet. Now, if you are able to stay apart from each other between 1.5 meters and 2 meters, those droplets cannot find their way into the nose or the eyes or the mouth of another person. Another aspect of social distancing we need to emphasize is the issue of self-isolation. Self-isolation is a part of social distancing. What does it mean? Whenever anybody suspects that he has been exposed to the COVID-19 infection, for example, those who came in from countries where there have been widespread transmission of COVID-19, or those who may have come in contact with people who ended up becoming cases of coronavirus, or people who may have been may be exposed in their professional work, like healthcare workers. When you suspect that, you do not wait to start manifesting the symptoms before you isolate. What you're expected to do is that from that moment on and for a period of 14 days, you should avoid contact beyond that 1.5 meters to anybody, including your family members. People who came in from outside of the country, which we refer to as persons of interest, we've told them, all the ones we're able to reach and spread the news and even in the media, that within that 40 days, stay away from your families. Talk to them, explain to them, be within a certain room in your apartment where you won't come in contact with your family, and that has really helped. So it's something that everybody can do. That is the good thing about social distancing. And during that period, watch out for the symptoms of fever, of dry cough, and of difficulty with breathing. The numbers are there everywhere. If you experience such a symptom, immediately put a call across. They will come and investigate and then help such a person out.
All right. Thank you so much, Dr. Alphonsus, for sharing your time with us.
Yeah, thank you very much.